Welcome to All Things Cardio-Oncology. My name is Steve Caselli. I'm the Executive Director of IC-OS. And in this podcast, you'll hear from a diverse representation from our community. We want you to be both informed and inspired by their stories and experiences, and we're so glad that you've joined us today. I want to thank you for joining us today on this podcast where we explore innovations and insights shaping the future of cardio-oncology. I'm joined as usual by my co-hosts, Dr. Dan Lenahan and Dr. Arjun Ghosh. And today we're talking about developing cardio-oncology services in resource variable settings, specifically what that looks like in Indonesia. We're really pleased to have joining us today the president of IC-OS Indonesia, Dr. Novi Tham, who's been instrumental in building cardio-oncology programs and leading educational initiatives through IC-OS Indonesia. So Novi, thank you so much for joining us today. And I wonder if you could start by just telling us a little bit about your background, how you first became involved in cardio-oncology. What drew you to this area of practice?
First of all, thank you so much, Steve, for this very kind invitation. So, hi, everybody. My name is Novi. I'm a heart failure cardiologist by training. However, during the second half of my fellowship at the National University Hospital in Singapore, I actually met a young patient in his early 30s who completely shaped my views. He was admitted with acute decompensated heart failure with a background of advanced heart failure into class 3 and LVF of only 20%, and it was caused by anthracycline-induced cardiomyopathy. He actually had been treated for acute lymphoblastic leukemia when he was a toddler, around 3 or 4 years old, with anthracycline-based chemotherapy. He was basically a cancer survivor. You know, seeing someone who had survived childhood cancer and was now in an end-stage heart failure really made me realize how essential cardio-oncology truly is. And it's not only in the pre-treatment and on-treatment phases, but also in long-term surveillance of cancer survivors. So it's really, really interesting.
Yeah, it's amazing how many people I talk to who get into this space really because of an individual case that they come across. And it's so complex and difficult, but at the same time, so moving to be able to assist these patients in really deep ways. So for many of our listeners, obviously the healthcare landscape in Indonesia is probably less familiar. So I wonder if you could just paint a little picture for us. What does cardio-oncology care look like currently across sort of the landscape of your country?
Yeah, so first of all, we actually a huge country. We have, 270 million populations. And I must say that cardio-oncology is still in early stages in Indonesia. And at the beginning, I co-founded the country's first cardio-oncology clinic in Palembang, South Sumatra, in Rumah Sakit Muhammad Hussein, which really marked the starting point of structured care in the country. Later, due to personal reasons, I have to relocate to Jakarta and join the Siloam Hospitals Lippo Village team, where I continued developing the service within a larger hospital network. And Siloam LV has since become Indonesia's first IC-OS certified center of excellence in cardio-oncology. However, I learned that still challenges remain. We still need to improve awareness, education, and also improve the uneven access across diagnostic and fragmented collaboration between subspecialties. But I can really see the momentum is growing. Collaboration is improved. Patients are asking more questions. And hospitals management are beginning to see that cardio-oncology are essential, not just optional.
It's amazing that you were able to get that program started. And I think it's not unlike, situations across the globe where people are stepping into a space that is new or developing. So maybe you could just tell us a little bit more, like how did you begin building your cardio-oncology service? And what were some of the first steps that you put in place? How did you begin to develop collaborative relationships across disciplines?
So I must say we started small, but sufficient, if that makes sense. We built a small core multidisciplinary team consisting of a cardiologist, oncologist, and nurse coordinator. And we developed a simple protocol based on the EAC cardio-oncology guidelines, starting also with cardiovascular risk assessment form, which also serve as our registry data. Then we perform the protocols, including the ECG, echocardiography, including GLS evaluations, NT-proBNP measurements. And then monitoring frequency was determined according to each patient risk level based on the HFA IC-OS risk stratifications. And then followed by periodic assessment during therapy and to ensure documentation of outcomes.
And what about collaboration across disciplines? How did you begin to build relationships, particularly with your oncology colleagues? What did that look like for you?
Okay, I must say the key was trust. We really focus on collaborative education efforts at the beginning and a continuous multidisciplinary meetings. So in our current hospital, we hold regular difficult case meetings where cardiologists, hematologists, and oncologists discuss patients together and align management decisions. In addition, I also make it a point to communicate personally to them. So not just provide recommendation through EMR charting. I personally call them, reach out to them, and discuss it directly with them. And I can see that this personal communication really build trust and encourage more dialogues and strengthen collaboration between subspecialties. And once they realize that our goals are aligned and that all we want is patient safety, improve outcomes, everything started to change. The collaborations becomes more natural and it grew and shaped like a culture of teamwork, I must say.
I think that's very similar to what we hear from many people when they're setting up cardio-oncology services, that initially there may be a degree of resistance, but soon they learn to trust you and then they can't live without you and you get referrals all hours of the day, every day. So I think that's the common theme. I guess that, education, of course, is a very important part of what you're trying to offer to educate cardiologists, oncologists, patients. So can you just tell us maybe about the situation and what you've been doing from the cardio-oncology education viewpoint in the IC-OS Indonesia chapter?
So I might say education is really important, as I've mentioned in the beginning. And through our chapter, our main goal first is to increase awareness and build national capacity in cardio-oncology. Because as I mentioned to Steve, that we actually a huge country. We have 270 million population with many islands. And we are actually currently preparing to launch our 6-episode webinar series. Hopefully we'll be launching next month. And each episode will focus on different class of cancer therapy, anthracycline, HER2-targeted therapy, ICI, and others. And we will feature both international experts and local speakers to create meaningful exchange. And also, we also aim to translate global evidence into the local language, and we probably do case sharing and for our clinical context so that clinicians across our country can access and apply cardio-oncology knowledge in their daily practice.
Yeah, so Novi, thank you so much for joining and explaining what's going on. I think we're so impressed many times at how people become motivated and then they, come up with a way to enhance cardio-oncology wherever they are. And I think your examples are prime examples of that. So, how do you think other places that maybe either have very little interest or generally constrained resources, how do you think they, go about building a program like you've done?
So I can only think about 3 things. First is patience, perseverance, and sacrifice. I think that's the key ingredient. So when we started, there was already some awareness about importance of cardiac assessment in cancer patients in our country. For example, many oncologists will refer patients just for echocardiography before starting certain chemotherapies. However, I find that this process is still fragmented. there was no continuity or structured follow-up after treatment. And also, we know that cardio-oncology is much more than just monitoring for a drop in ejection fraction. It also involves a pre-evaluation of cardiovascular risk factors, identifying which patients are at a higher risk, and also managing complications, and not only heart failure, but also extend beyond it, including, thrombosis, hypertension, arrhythmias, myocarditis, all of sort of cardiovascular toxicities related to certain type of chemotherapies. And also, as I mentioned to Steve earlier, survivorship program is really important. So our early work really focused on creating a structure and a continuous care pathway, and where also it's really important to have a close collaboration between the cardiologists and hematologists and oncologists. We need to communicate throughout the patient's cancer journey, before, during, and after.
Yes, that is truly fantastic, and I'm quite certain that's inspiring for a lot of people, especially us. But how can we, as an international society or as a collective, how do we encourage you, or how do we make the resources available that would enhance whatever you're doing? How do you think that's? I mean, if you could tell us the things that have been helpful and maybe some other things that we could do better.
Thanks so much, Dan. So first of all, really, really thankful of the IC-OS network. So it's been an incredible source of guidance and mentorship. And as I've mentioned earlier, in my early journeys, I was very fortunate enough to meet incredible mentors in both heart failure and cardio-oncology who guided me along the way. I met Dr. Lin he's a director of Advanced Heart Failure Program in Singapore, and then Dr. Tan Li Ling, which is she's a cardio-oncologist, and also I think at that point of time was representative of IC-OS in Singapore. And they're both from National University Heart Center Singapore, and they encouraged me a lot. And then also the late Dr. Renato Ong from the Philippines. So we met in Singapore, and he actually the one who introduced me to IC-OS earlier. And then I started to know about this organization, how you can find resources, webinars, all the sort of things. And then also I met Prof. Dan at, I think, ACC Atlanta in 2024. And then Dr. Alex Lyon, Teresa Lopez, Dr. Bonnie Key from Jack Cardio-Oncology, Dr. Aaron from Australia, and Dr. Chunta also from Singapore, and you, Steve. So really, really, IC-OS, it's become like a family to me now. I can easily reach out to all my friends, colleagues, and mentors from IC-OS network and discuss possible collaboration, networking, and then sort of guide me along the way. So I'm really, really thankful for IC-OS community.
That's such a nice thing to say, and we're so happy to be able to, be a part of that. And you're right. I mean, I consider all the people that you mentioned, and certainly, our great colleagues around the world that sort of lead the whole community in that regard. So we like it that people feel like it's a family, and we want it to be that way. So thank you so much, and really fantastic description of what's going on, and we're just so thankful that you have the kind of motivation that you do, and that you're helping cardio-oncology patients in a part of the world that really needs it.
And Novi, I wonder, what do you see as the future? You mentioned, you're in this vast country with millions of people, and you're the first center doing cardio-oncology. How do you see this developing across the country?
Yeah, so I really, really see that it's growing. So now we already have two, I think, officer center. The one in Palembang, it's currently under Dr. Alexander Ido, and then myself currently moved to Jakarta, currently in my current hospital. And then I also have many colleagues around the country who's already building their cardio-oncology program. And I also personally reach out to them and told them, don't be shy, just reach out to me. We can collaborate together. We're gonna build this together. I think that's the most crucial point, because we are a huge country. Sometimes the service can be a little bit more centralized. So we want it to be more spread across the whole country. So I think hopefully we launch the webinar, it can be people can get more sense about what we are doing. So not only just in Jakarta, but also in the different islands and province as well.
That's awesome. When I started with IC-OS, Dan will remember we would do a monthly webinar and there'd be like 4 or 5 people there, and so we started very small, just like you did, and it grows over time. So that's a good way to go. Arjun, any last questions or thoughts?
Yeah, I remember one of those webinars. It was just 2 people listening, me and my fellow Robin Chung. So we were the only 2 in the audience, and from that to kind of have hundreds of people come to the conference, and for it to be popular as a podcast on Spotify and other platforms is really a testament to the work that you, Steve, have been doing, along with Dan, Susan, and everyone else around the world in IC-OS. And really great to hear from Novi that Indonesia is benefiting from the collaboration of all the family members, as you say, of IC-OS. And it's just interesting. I mean, I'm working with an oncologist from Indonesia at the moment called Suyanto. He's based at Bart's Heart Center, the Oncology Cancer Center. And he's recently, or in the near future, he's going to be going back to Indonesia and set up some advanced cancer services there. And he wants to continue to collaborate from the cardio-oncology viewpoint. So I think that, as Novi was saying, more of these collaborations, education is only a beneficial thing. So great to hear the work that Novi and colleagues have been doing in Indonesia. Really inspiring for all of us, for sure.
Yeah, couldn't agree more. Thank you so much for taking the time to be with us today and for inspiring us to keep going in the work we're doing. It's so encouraging. Thanks.
Thank you so much. Thanks.
For more information about IC-OS, you can go to ic-os.org, where you'll find more information about all of our programs, including our weekly webinars, our board certification exam, and other resources that we know you'll find helpful. Thanks for joining us today, and we hope to hear from you soon.
Free audio post-production by alphonic.com.